Bypassing the public hearing process and straight to the special session, Bill 431 would give public health time to issue an invitation bid for interested companies to take over the island's senior centers, something GARP has been doing for more than 40 years. The legislation is timely because come Wednesday, GARP's contract with public health expires, and the Mayors Council would take over by March 1st. GARP Vice President Ben Ngoko is not happy the mayors will be running the operations.
I don't believe that they show respect with the Manamkona. You know that we need to have dignity for the Manamkona. You know that we have to show them love and respect the Manamkona. That is why the SPIMA employee is the best as of now. They already have been trained. I come across an article, a person who said, move over Manamko before I kick you. And that is going to happen if the mayor is going to take over. I know, because they were not trained to handle the Manamko.
According to Public Health Director Jim Gillen, he has been working on this senior center issue since last October, informing GARP of the fiscal constraints and smaller budget his agency is dealing with, but he says GARP at the time rejected the scenarios that would accommodate the lower budget. That's when Public Health looked into other alternatives and approached the mayors with the idea of an MOU to run the senior centers through October 2012, when the new fiscal year starts and a new contract would be signed. What's transpired, however, is GARP is now coming back to the table at the 11th hour, indicating it would be willing to accept the lower budget. Gillen adding the legislation could set dangerous precedents.
It's an interesting way to do it because you're really talking about now telling the executive branch how to operate a program. Okay, but if the legislature feels that this is a significant enough event, it's within their standing to do this. And I said I'm equally as happy.
Lawmakers during special session questioned why Gillen didn't issue an RFP for the senior center operations, and were also concerned about his statements about the legislature possibly overstepping its boundaries.
I really ask that we don't end up later on being the bad guy, or declared as the bad guy, or looked upon as going down the road of setting a dangerous precedent on something where all we were trying to do was help.
My concern only, and always has been, that there be no break in services, and on March 1st somebody is operating the senior centers. The way it gets done, maybe I won't like it, but as long as it gets the result that we want, and it's the law, I will follow the law.